This is Democracy Now!, democracynow.org, the War and Peace Report. I'm Amy Goodman. The World Health Organization has announced the spread of polio as a global public health emergency. According to the WHO, outbreaks in Asia, Africa, and the Middle East are an extraordinary event requiring a coordinated international response. The organization pinpointed 3 countries as posing the greatest risk of further spreading the paralyzing virus: Pakistan, Cameroon, and Syria. In an unusual step, the WHO recommended all residents of those countries of all ages be vaccinated before traveling abroad. It also said another 7 countries should encourage all their would-be travelers to get vaccinated. Those are Afghanistan, Equatorial Guinea, Ethiopia, Iraq, Israel, Nigeria, and Somalia. Bruce Aylward, the Assistant Director General of the WHO, announced the emergency declaration.
The Director General has declared the international spread of wild polio virus to date in 2014 a public health emergency of international concern. There's been 74 cases of polio due to wild polio virus so far this year. 59 of those cases have been reported from Pakistan. If the situation as of today and April 2014 went unchecked, it could result in failure to eradicate globally one of the world's most serious vaccine-preventable diseases.
As Bruce Aylward, the Assistant Director General of the World Health Organization, until recently, polio had been nearly eradicated thanks to a 25-year campaign that vaccinated billions of children. In Pakistan, the increase in polio is linked to a secret CIA ploy used in the hunt for Osama bin Laden. With the help of a Pakistani doctor, the CIA set up a fake vaccination campaign in the city of Abbottabad in an effort to get DNA from the bin Laden family. The Taliban subsequently announced a ban on immunization efforts and launched a string of deadly attacks on medical workers. For more, we're joined by 2 guests. By Democracy Now! Video stream, we're joined by Rafia Zakaria. She is a columnist for Dawn, Pakistan's largest English newspaper, who's been covering the rise of the polio in Pakistan since the bin Laden raid. Last year, she wrote a piece for Warscapes called "The War, the Women, and the Vaccine." And we're also joined by phone by one of Pakistan's leading polio experts, Dr. Zulfikar Bhutta. He's founding director of the Center for Excellence in Women and Child Health at the Aga Khan University in Karachi, and a doctor at the Hospital for Sick Children in Toronto. We welcome you both to Democracy Now! Rafia, let's begin with you. What do you think is responsible for this outbreak of polio in Pakistan?
Amy, thanks for having me on. I think, in Pakistan right now, what you see is kind of the perfect storm, where there's a collusion of factors coming together to cause a tremendous health emergency for Pakistan's women and children especially. You mentioned the CIA program that was used, the fake vaccination program that was used to collect DNA. In addition to that is the fact that the Taliban have been, since then, targeting the health workers that provide immunizations in Pakistan, polio immunizations in Pakistan. And the third factor is, of course, just, the underfunded nature of the Lady Health Worker program that provides these vaccinations. So all of these 3 factors have essentially come together to create a situation where in just 3 years, just 3 years ago, Pakistan was about to eradicate the polio virus. And you can see just across the border in India, where these political events did not happen, they did eradicate the polio virus. But we see 59 new cases. The cases are spreading, as I'm sure Dr. Bhutta will talk about. They've spread they used to be just in the tribal areas where the drone attacks are concentrated, and in Peshawar, which is the biggest city next to the tribal areas, to now all the way south in Karachi, which is a city of 20 million people, where the spread of viruses like polio can happen very, very fast. And you have to remember that these health workers that are at the front line of this anti-vaccination, this vaccination campaign, are paid $2.50 a day. So you have to see how the people who are at the very front lines of this battle who are trying to get the virus under control not only do they have very little remuneration, they have no security. So they're easy targets for the Taliban and other extremist groups. But the core issue, the central issue, is an issue of public trust. It is unimaginable that in the Western industrialized nations of the world, that a public health program would be allowed to be used as a front to essentially forward a strategic interest in capturing one or another person. But this is what has happened in Pakistan. And so you have a situation where among the rural areas especially, and also in the inner cities of Karachi and Peshawar, people don't trust the vaccine. They don't know what it does. First there was, when there's a rumor that says that Pakistani children are being sterilized by this vaccine, and then you have the truth of the fact that the CIA did use the program, it's very, very difficult to convince people, even educated people, that the vaccine that their children are going to get is one that hasn't been tampered with.
Dr. Zulfikar Bhutta, can you respond to the virus and the polio emergency that's been announced by WHO and what's happening in your country of Pakistan?
Well, thank you very much, and I'm grateful for the invitation to join you this morning. Let me just add to what Rafia said. I mean, where I agree with her is this current perfect storm of a variety of issues and the lack of public trust in a broad polio immunization program. However, I don't think the blame for the failure of polio eradication in Pakistan can be placed entirely on the bin Laden episode, which, deplorable as it was a problematic issue that happened at a time when we needed to build public confidence and not the opposite. What has happened in Pakistan is that you have virtually a civil war going on in some parts of the country, notably in the federally administered tribal areas, the Taliban-controlled areas, where nobody can enter. And yes, of course, health teams cannot enter. And as a result, it's been impossible to vaccinate large bodies of children, and people moving out of that area have been able to carry viruses to all parts of Khyber Pakhtunkhwa, the neighboring province, and because there's a large proportion of people who travel down to Karachi and migrate there, there is also transmission of virus in those areas. So there is a very close link of polio program in Pakistan with the barriers of conflict and war. And as you can imagine, in the parts of the world where the virus has spread or re-emerged, these are also geographies where there has been conflict and a breakdown of primary care and health services. Somalia, Syria, the isolation of the virus in Iraq, parts of Afghanistan. So I think it is important to recognize that we are trying to eradicate a disease globally in the midst of very adverse situations, of which there are a range of factors, including conflict, breakdown of public health services, disinformation, which is flamed by incidents such as the Shakil Afridi CIA ruse, and also the fact that the disorder is now unfortunately being politicized. The Taliban have deplorably not only resorted to attacking health workers and thereby creating this climate of fear amongst the primary care health workers program and the population, but have also used polio as a vehicle for political negotiations. The North Waziristan Taliban leaders stated that they would only really allow polio campaigns or polio entry into their area if the drone attacks were stopped. So it is a very unfortunate situation which does place a huge responsibility on everybody concerned to take a very rational, balanced approach to what needs to be done and not a knee-jerk response.